I'm Pat Gordon. I'm a licensed clinical social worker with Singing River Health System Behavioral Health. And today I've put some information together about life after a stroke. I hope you can find this information helpful. Personality changes after a stroke. Personalities may change due to symptoms of depression and/or anxiety. Having a stroke is a life-changing event. It can change how you feel about yourself and cause worry about the future. Depression and anxiety are common after a stroke. Depression is the most frequent emotional complication of a stroke. Untreated depression can make it more difficult to recover from a stroke and can increase the risk of cardiovascular disease. Risk factors for depression. Having had a previous mental illness, if you are female, had a previous condition that affected how you think, such as a traumatic brain injury, other anxieties or depression, if you've had a previous functional difficulty like Parkinson's disease, if you live alone, and the level of severity or impairment from the stroke. Depressive symptoms may be more noticeable by others like a caregiver. Depression may begin sooner or later, even months, depending on social circumstances such as loneliness, lack of social interaction, genetics being predisposed, or physical or mental limitations, inabilities after the stroke. Signs of depression. They are feelings of sadness, anxiety, which include restlessness, irritability, and uncontrollable worry. Loss of interest in normal activities. Feelings of worthlessness and hopelessness. Fatigue. Difficulty focusing or concentrating. Disturbed sleep or too much or too little sleep. Loss of appetite or overeating, reduced interest in spending time with family or friends, suicidal thoughts or thoughts about death, mood changes including irritability, agitation, aggressive behavior, hallucinations, which can be either visual or auditory. The treatment for behavioral changes after a stroke. There's psychotherapy, and that may involve cognitive behavior therapy, which is to identify and change negative thought patterns and create positive problem solving. There's behavior therapy, and that involves doing activities that are rewarding and also changing behaviors that have not been productive. There's interpersonal therapy, which involves improving relationships and coping with stress and sadness. There is also medication treatment, which generally is provided by psychiatric mental health practitioners. Lifestyle changes, healthy diet, activities, physical exercise outdoors, and relationships. There are support groups. Meeting others may help you feel less alone. There are also concerns about sexual changes with a stroke. Depression, as well as physical limitations, can affect sexuality and intimacy. This is very common. Self-esteem can be affected, as well as any desire for relationships or intimacy. With time, this can improve, often with the help of therapy and medication management. Like all aspects of emotional and physical functioning, there will be adjustments to a different way of life and feeling a sense of loss or sadness about what was important with intimacy. Caregivers and family members. Caregivers and family members of a stroke survivor can experience anxiety, depression, and burnout. It's important that you're aware of the following. Self-care. Take time for yourself and develop awareness of your own needs. Keep check on your moods. Know your limits and ask for help. Get enough sleep. Educate yourself about stroke patients and be a part of the healthcare team if possible. Reach out to your primary care physician if you find yourself depressed or experiencing mood changes. You can also join a caregiver support group. I appreciate you giving me this time to be with you today, and I hope this information was helpful. Just to let you know, in order to reach us here at Behavioral Health, the best way to access our services is to first go through your primary care physician or nurse practitioner, and they will be able to assist you with making the referral.